Welcome to the Dynamic Radiologist Podcast, where we feature leading experts in healthcare. And now, here's your host, Dr. Stephen Brownstein.
Hello, Dr. Stephen Brownstein here, and I am the host of the Dynamic Radiologist Podcast. Through this platform, I have the great honor to interview top leaders in health and in business to discuss what they are doing to change the world. Some of the amazing guests I've interviewed include Dr. Jeffrey Kronk, CEO of Spinal Kinetics, Smart Injury Doctors and Smart Injury Lawyers. Dr. Mike Carberry, CEO of Advanced Medical Integration. Dr. Donald DeFabio and Howard Reese, CEO of the Teledentist. This episode is brought to you by Dynamic Medical Imaging. I started this organization 16 years ago and have experienced consistent growth and opportunity ever since. We have the only phonar upright MRI in central and northern New Jersey, and we have had patients consistently coming to our center from over 20 miles away. Over 25% of our patients are either claustrophobic or have failed to have their MRIs completed in a closed unit. They have come here to have their studies performed in the phonar upright open MRI. We've had over 3,000 doctors from New York, New Jersey, and Pennsylvania refer their patients to us. What is really telling, though, is that those same doctors who have referred their family and friends have come here themselves to have their own studies performed. Please check out our testimonial comments and interviews on our website, www.dynamicmedicalimaging.com, and see for yourself what your fellow patients have said about their great experience at Dynamic Medical Imaging. We are also sponsored today by Spinal Kinetics. We started this company over 10 years ago. We help medical providers of all specialties evaluate the presence, location, and severity of spinal ligament injuries. If you do stress radiographs of the cervical and lumbar spine in any format, you can send them to our trained doctors who use our special technology. Spinal Kinetics developed a technology called CRMA, or Computerized Radiographic Mensuration Analysis, which is an advanced X-ray measurement technology to accurately measure the exact abnormal motion patterns that occur in the spinal ligament injury. Today, I had the great pleasure to interview Dr. Bruce Bromberg, who's a practicing chiropractor for over 25 years in New York, and he has some areas of specialty that we'll get into. Good morning, Bruce.
Good morning. Thank you for having me.
It's my pleasure. So tell the audience your story. Why'd you get into chiropractic and how your journey's been and where you are today and where you're going to be tomorrow?
Oh, wow. It's a long story, being that I graduated in 1986 from Life Chiropractic College in Marietta, Georgia. But when I was in my early 20s, I had spinal problems and pain. I was a really good athlete, and when I had a bout of spinal pain that knocked me to my knees, I went to a medical doctor, and he just gave me some medication and said that, you're going to have this basically, on and off for the rest of your life. And, that really wasn't acceptable to me, but, I took the medication, but I couldn't function. And then I stopped taking the medication and went on with my life. I was young, I was able to withstand some injury and pain, but it got unbearable. And there was a chiropractor across the street from my house. I went to him and he took some x-rays and showed me where my rotations were and whatnot. And I got it right away. And then when he started working on me, and I didn't feel any pain after that. And the mechanics of it, the way he went about correcting me, just opened my eyes to something that was unusual and not mainstream, that I thought, boy, this guy's onto something. And then a couple of years went by and I was going through my own process of thinking about what I want to do for my life. And I thought to myself, geez, I could do that. That's something that I really would like to do. And then one thing led to another, long story unto itself, but I finally got into college and chiropractic school. And then I was practicing, and I always used X-ray as a format of my diagnostic procedures. And most chiropractors would say, well, you don't adjust off of x-rays. Well, that's true to a certain extent, but to recognize a pattern in the spine or any degree of rotation that you normally could not find through palpation and examination, I mean, x-ray is just an invaluable technique to use.
So, one of the things, there's things that you want to treat and things you don't want to treat. And without doing x-ray, there's a distinct possibility that, if there's a fracture that you don't diagnose and you treat, then patient has pain, and then they first x-ray, then they see a fracture. Well, it sets you up for, a lot of questions that you never want to have asked to you, because did your treatment caused the fracture, or was it there before? And you have no proof radiographically. But if you x-rayed ahead of time and saw a fracture, you change your treatment. You wouldn't be as forceful in that area. You probably treat around it rather than at that level. So, it's somewhat protective of the chiropractor. In order to properly diagnose and treat, you should do x-rays. One, to make a diagnosis to help your physical exam and correlate that, and two, there's things that you keep your hands away because it won't help. It may worsen the problem. So I agree with you that the school of thought where x-rays are not important is totally wrong. And I know up in Canada there's a big battle that they want to ban x-ray, and it just doesn't make any sense to me. It's Palmer was the first person to buy an x-ray machine, I think, west of the Mississippi or something like that. He believed in it from day one. The founder of your profession believed in x-ray from day one. And it's one of our companies, Spinal Kinetics. We basically, doctors send their stress radiographs, flexion extension radiographs of the cervical lumbar spine. And now we use advanced computer analysis to measure intersegmental motion abnormalities that you can't diagnose with your own eyes. Most radiologists don't even know to look for it. And even if they did, they wouldn't be able to identify these subtle changes. And we've, published an article on that where we took 100 cases and sent it to a radiologist, and also did our CRMA, computerized radiographic mensuration analysis on it. There's 26 severe sprain findings. Radiologist wasn't able to find any. So, we were taught, you see what you look for what you know. But even if doctors like myself looked for it with their own eyes, I went back and I still couldn't find 50% of the abnormal severe sprain findings, knowing what to look for. So it's probably spinal ligament injuries are the most frequently misdiagnosed or undiagnosed injury when you're in a motor vehicle accident. And it's the leading cause of chronic spinal pain, because you get advanced degeneration of the spine if the vertebral bodies are out of alignment. And that, I'm preaching to the choir. But yes, I think x-ray is extremely important. I know you recently installed a new high resolution x-ray equipment in your office, and that will only enhance your ability to serve your patients. And you're probably one of the few chiropractors that have invested in that high technology. You want to comment on that, Bruce?
Well, it's not just the machine itself, which I got a very advanced digital machine that is delivering fantastic imaging, but it's the electrical supply coming to the building and from the street to the building. It's very important to have the wiring with minimal resistance. Some offices don't have the ability to get a good electrical flow, and they have to purchase capacitors that sit in the body of the machine that delivers the electrical bursts of energy to get a good picture. But I didn't really need that, but I needed these very sophisticated cables, 3 Ort or something like that, but they were like 175 feet long, so it's quite expensive, and it was a big investment. But I'm happy I did it, and pictures coming out beautiful, and I'm able to see the precise conditions and problems that need to be corrected. People have different views about this, and I've seen it over the years with different people who kind of justify not having an X-ray machine unsuccessfully. And they telling me that, well, we can palpate and we know everything that's going on. But if you don't see what's going on, you're guessing. And if you're guessing with people's health, that means that you're putting a high velocity, adjustment into someone's spine, and you actually don't know what you're doing exactly. And if you don't know what you're doing, that means you're treating people and you don't know what you're doing. And that's bad. And you have to know what you're doing. You have to be able to rule out pathology and understand the condition of the spine before you start making corrections. And there's just no way you could do this without visualizing and imaging.
Absolutely. So you mentioned, palpation, and one of the, I wouldn't say problems, but one of the observations they've made, and whether it's chiropractic or osteopathic, the inter and intra-observer variation on physical exam, and even in medical, there's inter and intra-observer variation. So, it's important that you try to bring as much objective documentation and diagnoses into your practice. And that's why, quantifying the amount of abnormal intersegmental motion is important, because it gives you data, that, you can show your patient that, here is, you have a 3.5 millimeter translation, one vertebra in front of the other, and you can actually show them that. And people like seeing numbers. Everybody wants to know where they stand. So it's extremely important to, become more objective in your practice, rather than, just relying on your fingers, which, you're a seasoned chiropractor, and, you've examined thousands of backs. And I believe that when you think something's there, more times than not, it is. But to have the backup and the supplemental information from X-ray, I think, is huge. But let's change topics a little bit. I know you've taken a number of courses with Mark's student, and you never stop learning. And one of the things that you learned not too long ago, is what they call manipulation under anesthesia, or MUA. And you've probably done more procedures than any other chiropractor I know. And you want to tell the audience what MUA, or manipulation under anesthesia, is, what it's used for, what patients are candidates for that, and we'll kind of dive deeply into that.
Sure. Manipulation under anesthesia is pretty much what it sounds like. It's an adjustment to the spine and extremities while the patient is absolutely relaxed. That's much different than doing it in a conscious state. And more could be accomplished. For example, let's just take, I'll give you two examples. Let's take an example of a shoulder, a post-operative shoulder. Someone has a rotator cuff injury or a labial tear, and they have the orthoscopic surgery to the shoulder. And after healing takes place and whatnot, the layers of fascia and tendons and everything that passes through to get into the joint by the three little incisions that they do with the camera and the hose and the instrument, those things heal, and essentially they heal onto one another. And it's very hard for them to recuperate from this procedure, because as they're going through their therapy, those adhesions in there prevent them from successful therapy. Let's say they can only abduct the shoulder like 150 degrees or 160 degrees, but that's all they can get without extreme pain. And these are people that would do very well under manipulation under anesthesia. So you put these people under anesthesia and they get very, very relaxed, and you manipulate the shoulder in a certain way, gently, of course, that breaks up the adhesions. And when they wake up from the anesthesia, which is only like a few minutes, they can move their shoulder 100%, and they feel much, much better, because there isn't that internal pulling and jabbing and adhesions inside the joint anymore. Another example is a cervical disc herniation. Let's say, for example, somebody has a disc that's um, not sequestered. It could be extruded a little bit. You have to use your judgment as a clinician to see which types of conditions you want to work on. So having the MRI is very essential in that regard. But if somebody has a disc herniation in the neck, as they're under the anesthesia and all the muscles that connect the vertebrae, the intervertebral muscles, the large muscles on the side of the neck, as you axially decompress the spine, you separate the vertebrae, causing a vacuum effect inside where the disc is, and it sucks that disc back into the vertebral body, and you reduce the disc herniation. And I've worked on people that were contemplating surgery and had severe radicular pain down the arms and numbness in the fingers, and even something that mimics bilateral carpal tunnel syndrome that is obviously coming from their disc herniation in the neck that gets reduced immediately. And it's so satisfying to feel that happening as you're doing the procedure as a clinician. This can be done very quickly and very safely. The anesthesiologists that I've worked with are top notch. And the method of going under anesthesia is also quite safe. There's no intervention as far as like injections or anything other than a manual manipulation. So it's a very safe procedure, if you know what you're doing and if you know what to stay away from and what not to treat. And that comes with training and experience. And I've had a long run with the manipulation under anesthesias, and I had virtually every patient that I worked on had a positive result. The more severe the injury, the more dramatic the result. The less severe the injury, the results weren't as dramatic, but they were always positive. I really have never had a negative result.
That's great. So where are you practicing now? What tell the audience if they want to locate you, how to go about that.
Well, I'm practicing in Westbury, New York. The address is 179 Unit A, School Street. And it's a small office, but I have everything I need. I have a full gym quality workout center. I have all the therapy necessary to rehab shoulders and knees and post-surgical conditions. And I have full functioning x-ray, and I'm able to deliver the quality of care that makes me excited to get to work every day and treat people.
That's great. So, going back to your initial intro, it's interesting. Chiropractors go into chiropractic for one of two reasons: either a family member has been in chiropractic, or they've had their own experience with the chiropractor that helped them when allopathic medicine couldn't. And you fall right into the second category, where you couldn't find relief from your injury. You went to an MD. You tried to help, but couldn't. Did not get the results that you needed. You went to your neighboring chiropractor, and he did help you. So, it's extremely rewarding when you go into a profession that you had firsthand interaction with, and you became a believer in the science that there's validity to the practice, and you actually help people. And I was reading, through the pandemic, most chiropractors stayed open for a couple of reasons. One, the main reason is they wanted to treat patients, so they didn't have to go to a very busy emergency room or primary care doctor that were either closed or overwhelmed. And two, because they actually could provide relief for the patients that now the stress level is even higher because of the anxiety and fear out there. And, the profession did a big solid to us Americans by staying open during the pandemic. And actually, the chiropractic now becomes more accepted because people actually see, more people are seeing the results. The most efficient, most effective treatment is chiropractic rather than pills and surgery. So I commend your profession and you personally, because I think, you're doing a great job. And I recommend Bruce to anybody that lives within 5-10 miles of Bruce's office. He's a mensch. He does what's best for the patient, and he's available to speak to the patient and answer whatever questions they may have. And it's been a pleasure to interview you, Bruce. Pleasure to become a friend of yours, and I look forward to further conversations and seeing how we can help each other help more patients. I thank you for your time.
Yeah, you're very welcome. Just want to say there's no chemical solution to a physical problem, pretty much. So that's how I function. And I'm very happy that you had me here. Thank you so much. And I look forward to an ongoing relationship with you.
Okay, Bruce, pleasure. Stay safe and stay well.
Bye-bye now.
Thanks for tuning in to the Dynamic Radiologist podcast. Make sure to click subscribe to get updates on our latest episodes.